so that we can use all of this and make sure folks can hang on. Okay, so welcome everybody. I'm going to, for what it's worth, be a moderator. And we're going to see how that goes. But my name is Jen Pishko, and I am co-founder of the CrossFit Medical Society. I am extremely excited to have not only the co-founder of the CFMS and my business partner, Dr. Tom McCoy, but also Andy, who is CEO of CrowdHealth, and that is the organization that partners CommunityCare, to have these two gentlemen really go deep into some, I think, hot topics, if you will, that not only identify what we're living in terms of potential problems, but really highlight the hope for solutions. And that's kind of our major takeaways, I think, at this point. So in a second, I'm going to turn it over. Where my role comes in is I'm going to monitor the chat. So if you are on live with us and you do have questions, put them in there as you feel motivated to, and I will pull them out hopefully at appropriate times and just feed them to these gentlemen. They can, spin it and keep rolling with it. Tom, why don't you go ahead and introduce yourself, because this is an open webinar, so there's going to be folks on here that might not be in our crew yet, and then I'll toss it to Andy after that.
Okay. Yeah, I'm generally pretty loath to do the lengthy introduction, so we'll try and keep it succinct. So my name's Tom McCoy. I am a CrossFitter. I'm a CrossFit affiliate owner. I'm a CrossFit coach. I have an L2. I'm also a physician, and I have a private practice and was a county ER doc for many, many years, and in leadership for many years. And in addition to private practice and the gym, work with some medically marginalized low-income communities on the east side of Cleveland as well, which I just came straight from, which is why I'm scrubbed out at the moment. So pardon the attire for this evening. But I say all of that to highlight that, I've been a doctor for almost 20 years now, and have worked in a lot of very different situations within the medical sphere, from being a unionized county employee as a medical director to being a medical director for a national, genomic tech startup that has gone public. So I've been kind of in most situations, and for better or worse, have an unfortunately deep understanding of some of the dysfunctions that the system has. And I'm excited to unpack that a little bit this evening about what brought kind of Andy and us together for this project called CommunityCare.
Well, thank you. All right, Andy, you're up.
Awesome. Thank you. Just super happy to be here and excited to be working with, CrossFitters to get CommunityCare off the ground and launched. And I think it's going to be an incredible community of people. Quick background. This is my second healthcare company, and I sold my previous company and came off of that and didn't have health insurance. A lot of us get health insurance through our employer. And since I wasn't employed any longer, I didn't have health insurance. And so I went to healthcare.gov to get a plan off of the marketplace. And I kind of joke it worked until I had to use it. My little one, who was one at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, who said she had a hole in her eardrum. And so we had to get that fixed. It was a pretty simple procedure, about 15 minutes. Went to the in-network provider, did everything right, then got a bill a few weeks later, and it was $8,000 for a 15-minute procedure. And I was just blown away by that. And I was like, okay, well, this is what health insurance is for. Like, this is the whole point of health insurance. When you have something big happen, the health insurance is supposed to come and help you out, right? Little did I know, a few weeks after that, I got another note in the mail, snail mail, funny enough, from the health insurance plan that said it was medically unnecessary, and so they weren't going to pay for it. It was at that point where I knew that something was just broken. I didn't really know why at that point. It wasn't until I had done some more research as to figure out really why this is broken. But I decided to cancel my health insurance and go uninsured. And as my wife kind of looked at me, she's like, okay, what are we going to do now? I had to figure it out. And so I started coming up with some tools that allowed me and my family to operate viably outside of the legacy insurance space. And those tools kind of culminated in me getting this idea that I think other people would want these tools too, given that nobody really likes their health insurance. I know when I had to use my health insurance, it's almost like, okay, now I have to fight my health insurance to get this thing paid. It just was not satisfactory to me. And I knew that there was an alternative. And so I started CrowdHealth in April of 2021. And so it's been, I guess, 3.5 years when we started the organization, and we've gotten 10,000 people to join us on this mission to revolutionize the way that we pay for healthcare. And one of the things we found along the way that has been just incredibly effective is, can we get communities of people that share a similar worldview, similar lifestyle together to fund each other's healthcare bills? And that, like I said, has been super effective. And our first one, funny enough, was a Bitcoin community, a community of Bitcoiners who were all funding each other's funding each other's health bills. Then we came up with a carnivore crowd. So it's just, these are all people who eat low carb that are funding each other's health bills. And as I started talking to Tom, I said, hey, wouldn't it be great if we could get a bunch of CrossFitters together funding each other's health bills? As I know you all, I have very good friends who are CrossFitters. And I know you take care of yourself, you have a healthy lifestyle. And I don't think it's fair for people who have really healthy lifestyles, who are hitting it, multiple times a week, maybe every day at the CrossFit gym, to subsidize those lifestyles that aren't taking care of themselves, that don't have the same lifestyle. And so the vision here between me and Jennifer and Tom and some of the folks at CrossFit Corporate is to gather a group of CrossFitters who could all fund each other's healthcare expenses. And as a result of that, have significantly lower costs than what you would find in, your regular health insurance plans, whether it be the marketplace plans or even employer plans. So that was the big vision. And, we're off to an awesome start getting folks in CrossFit together to form this community. So that's a little bit of a background as to who I am and the origin story of this CrossFit crowd, if you will, and why we're here today.
No, that was great. Thank you. All right, Tom, you ready to dive in, or you want me to shoot off a question?
No, I mean, there's a couple of things I think to mention there, right? I think that one thing, that you brought up, Andy, that's come up in the podcast and the discussions that we've done since we announced CommunityCare, when we talk about how the system is broken when it comes to traditional healthcare coverage and insurance. And the point has been brought up a couple of times that it's actually not broken. It functions exactly as they want it to function, for those who are controlling the purse strings and trying to generate more.
Yeah.
Right. They do a very good job at taking a significant amount of money, right, from the population, and have gotten really, really talented at finding ways to minimize responsibility and actually compensate and cover the things that they've committed to being able to cover for us when we need to use it, right? When you're in your most vulnerable, right, and potentially emotional time period, when you may be going through a significant health event. And I think one of the things that I think all of us are going through, even societally now at this point, is really reflecting on, what we're told and what's actually happening. And I think when you start to look past the names and the words of healthcare insurance and healthcare coverage, and what you actually get for the tens of thousands of dollars that you pay into the system, and how you're treated, and the way that the money flows, and the vertical integration that's happening, right, between how healthcare insurance companies are now becoming provider networks, are now managing pharmacy benefit systems to vertically integrate all of that income so that they're essentially paying themselves. Once you start to become a more educated consumer and then see how it can be done through transparency and relationship, and returning autonomy to the individual, into who they're partnering with from a healthcare provider standpoint, it becomes much more understandable why people are as angry and as frustrated as they are. So I'm just very excited finally to be able to channel our energies to actually have an alternative solution for people, where it doesn't have to be fatalistic that we're stuck in this endless cycle of dysfunction, that we can, as we say a lot, we can take it back, right? We can take back our autonomy. We can take back control of our journey. We can take back our finances and have control of those, about where the money goes. We can have some skin in the game, right? With transparent pricing and understanding what it's cost. And if we have a major event that's catastrophic, we know that a community of like-minded individuals has our back, right?
Exactly. Yeah.
I'm really, really excited that, we were able to form this partnership and launch this for our community. Because I think philosophically, and morally, it's right up our alley as a CrossFit community.
Yeah, amen. I think there's a couple things there that come to mind. And I think that, one of the things that people ask me is, or I guess tell me, like, oh, healthcare is so complex and they can't understand why healthcare costs keep going up. And so if I may just really quickly explain the reason, because I don't think it's actually that complex, although they want it to be complex so that you don't understand it and don't question the authority, right? So in essence, what we have in healthcare is that you have the buyer of healthcare, which is health insurance, right? Health insurance are the ones actually buying the healthcare. What few people don't understand is they actually want prices to go up over time. And that's a problem. And let me explain it real quick and hopefully with pretty easy math here. So if my premium every month is $1,000, the most that the health insurance plan can make is $15 of that 100, or excuse me, or the $150 of the 1,000. I'm bad at math already. And so, they're for-profit companies, and so they want their profit to go up. So how do they get their profit to go from $150 to $165? Well, your premium has to go up from $1,000 to $1,100. So if your premium was to go down, that means their profits would go down. So they actually want your premiums to go up over a period of time. So you have the buyer of healthcare wanting the prices to go up. The sellers of healthcare are big hospital systems, doctors. They all want the price to go up. They want to make money too. It's a capitalistic society. I have no problem with that. But when you have a buyer of healthcare and the seller of healthcare both wanting the price to go up, the price is going to go up. And so that's how we have all these perverse incentives within healthcare, is you have pretty much with everybody within the healthcare system wanting prices to go up. So there's no market forces pushing prices down. And so that's why we've got this, just crazy, inflation rate of healthcare expenses. The other thing that you mentioned there that I think was interesting was just this autonomy, and I think we all feel like we should have personal autonomy over our healthcare. And one of the things that I say is that you work for whoever pays you, right? Whoever pays your salary is the one that you're working for. They're the one that you need to satisfy. And in our healthcare system, unfortunately, doctors are ultimately paid by health insurance companies. And so what they have to do is they have to provide you just the care that the health insurance plan will reimburse for. So they, in essence, are paying for the health, they're trying to satisfy the health insurance company and not necessarily you. So if you think about a doctor-patient relationship, it's not there in our current system because you've got a health insurance plan and oftentimes the government in between you and your doctor. So in essence, what we're trying to do is saying, no, it should be between you and your doctor with no other intermediary. So CrowdHealth is a platform that enables you to go into your doctor and pay in cash for small bills and large bills, so that your doctor is actually working for you. And so that's a total change in the way that doctors operate. And I know now, being 4 years in, actually more than 4 years in, being a cash pay patient, it changes. I mean, the dynamic between the doctor and the patient totally changes when you come in and say, I'm paying in cash. Because then they're like, oh, okay, it's between you and me now. This is great. let's talk about what actually we can do to improve your health, as opposed to what can we do within the insurance plans, rules, to be better for your health. And so I think paying in cash for healthcare services, we can talk about the mechanics of how this works, is like the ultimate form of healthcare autonomy, because it reestablishes that doctor patient relationship.
No, I think those are hugely important points. And two other ones that I would add on to the financial component of it, which I think is really important for everyone to understand, that the way large health insurance companies and corporations continue to leverage profits in different ways is through vertical integration and the purchase of huge
Yes.
physician groups, right? So whether you're talking about Village MD or Oak Street or Millennium in Florida, these are enormous physician groups that the largest health insurance companies now own. So not only are they okay with prices going up, because they're actually paying themselves, right? So when
Yeah.
the insurance company pays those physician groups, they own those physician groups in the same way that they're vertically integrated with the PBMs, because they own those, right? So even though they maybe not making a profit in one section, they're paying themselves. And because of how they structure things from a bookkeeping standpoint, that allows them to skirt a lot of the regulations that are set with the profit margins that are set with the 15% of the premiums, right? Because they can pay themselves in other ways. And as we've seen, and has become much more public, right? Denials have gone up significantly, right?
Hmm.
Prior authorizations, and right. So if you get really good at it and you can float, right, that financial burden, right, through your books, and you deny more services, that's money that you're investing and recouping more income on, and you're not paying out. And so that's one of the things that, from a regulatory standpoint, the lobby is so powerful and so strong, to think that there's going to be wholesale change when many of these companies play such a significant part in the funding of political parties and individual politicians who make those decisions. We have to be very honest with ourselves about the fact that at a certain point, we're going to have to put our money where our mouth is and start speaking with our dollars and our behavior. And this is a way that we can do that, right?
Hmm.
I'm, I think it's a really important concept for people to understand, because all these companies have different names. They're all subsidiaries, and that network of connection is not clear.
Well, United Healthcare is the largest owner of doctors in the country. So
Yeah.
United Healthcare actually owns 100,000 doctors.
And most
So
people
there's
have
a
Optum, right? But most people don't understand that that is United Healthcare.
Yeah, it's a wholly owned subsidiary of United. So there's 1 million doctors in the United States, and 100,000 of them are owned by United. Another crazy stat that I saw the other day was United, Blue Cross Blue Shield, Cigna, and Aetna together, just the four of them, have a more revenue than the defense budget of the United States. So that's four companies have more revenue than the defense budget. I mean, that's an absolutely incredible number.
It is.
And given that concentration, that they have all the lobbyists in DC, they have all the lobbyists on the states who are fighting for them and their interests, and so what we're trying to do is take that away from them. So now we're working as individuals, autonomous individuals, personally responsible individuals, as opposed to being kind of shackled by, what United and Cigna and Aetna want to do, which is not necessarily what's the best for you.
I think it might be helpful, Annie, for us to talk a little bit about why some things can cost, the same thing can cost such a different amount of money when it's 3 blocks away, and kind of what a charge master is, why certain services at one hospital will cost 10 times as much as others, why there's a lack of transparency, and how this translates into us not having any clarity as a consumer as to what our bills actually may be. And I'll let you start because you're the expert, and I'll fill in whatever holes I can come up with.
Yeah, sure. just a quick story. I like getting my labs done a couple times a year, full panel labs. And I live not too far from a place to do it that's belongs to a hospital system. And so I went and did the price check there, and it was, I think, $1,000 for my biannual set of labs. And then I was like, you know what, I know it's right across the street, but I got to check with CrowdHealth just to see, what. And I know you guys have some really amazing rates too, and it's probably better than our rates that we're getting. And it was like $75. And like it's and I had to go 3 miles to do it, but by going 3 miles, I saved $925. And that's the craziness of this system. You would never go, buy a car, for whatever, $30,000 here, and then 3 miles away you could get it for 20. We would always, go that distance for, that extra savings, even though this one's only $925 as opposed to 10,000. But that's the craziness of this system, is there is no transparency into pricing, because it's all dictated by what a health insurance plan, 1,000 miles away or whatever will pay for that. What we really are trying to leverage is that when you go into a doctor's office or when you go into a hospital and you pay them in cash, they get to rip out the entire administrative bureaucratic component of their cost structure. So there was a study that just came out that said doctors spend about 15 and a half hours per week on administrative tasks that are related to billing. And so that's almost 2 days a week on just billing, where they can't see patients. If you're a CrossFit affiliate, or trainer, let's just say a trainer, right? Let's just imagine that, 2 out of your 5 days that you could be working, or whatever, 2 out of 6, you're just fighting with your affiliate owner to get paid. Like, nobody would do that. Like, that's craziness in any other part of our economy. And so if I can give those 2 days back to the doctor, and by the way, each doctor has somewhere between 2 and 3 billers that they have to employ to bill for what the services they're providing. And so what if I could rip that out? That's all an insurance bureaucracy that if I go and pay with a credit card, it's a couple percent. And so by going and paying in cash, you can rip out all that middle, and you're now seeing the savings of that. And so that's the beauty of being able to pay in cash as opposed to billing through insurance. And it's just, unfortunately, a part of the system. And what I've said, these insurance companies put in all this bureaucracy, they say, because they're trying to reduce fraud, right? They're trying to reduce fraud and waste, which people think is somewhere between 5 and 10%. So in essence, what they're doing is they're putting 40 or 50% bureaucracy to save 5 or 10%. It's the saying, penny wise, pound foolish. And so that's the where we come in, is we allow you all to pay cash, ripping all that out, and you're getting the savings for that. And that's just the beauty of paying directly to the doctor.
Yeah. No, that's a great description. And I think the things that are also so frustrating about pricing and how that gets built is that, each charge master, right? So the charge master is essentially the pricing for each individual thing that occurs at a hospital, right? So when you go in and you get in, correct me if I'm wrong, Andy, right? But this is my understanding. When you go in, and you're lucky enough eventually to get an itemized bill if you can, right? There is a series of a multitude of different numbers that will ultimately relate to kind of the price the charge master outlines, right? But the one at each facility will be different. And what actually happens is that hospitals will contract out pricing strategists on how to build their charge master, right? And one of the practices that happens a lot is that they will look at things that they do a lot of, and they will have those prices be significantly high, where they will charge a much lower price on others, right? But they'll charge sometimes 10,000% for gauze and other things, or if they do a ton of OB, those services will be charged higher because it will cancel out the much lower costs that they have on other things. And then the total amount, right, for what they can charge stays below a certain amount. So this manipulation strategically done based on the services that they do provide, that they can then negotiate rates on the back end with insurers that look like you're getting a discount, but these are on prices that are inflated 10,000, sometimes 15,000%, right? And you'll go from 15,000% to 10%, 10,000%. You think it's a great deal, but because we have no insight into the true cost of this, we're all getting taken to the cleaners. And so one of the most important things that we can continue to do is to just fight for transparency across the board so we can be informed consumers. And it allows the money to go back into, physicians' pockets, the people actually bring value to the system, right? And keep it in the patient pockets, right, where it should be.
Yeah, I think, if you think about it as, imagine you're going and buying I'm going to use a Toyota Corolla, right? And you go into the car place and they said, hey, guess what? Our list price on your Toyota Corolla is $100,000, but we're going to give you a great discount. It's going to be $50,000. We're giving you a 50% discount. Congratulations. But you're looking at them and that this Toyota Corolla is only worth $25,000. So you're like, this makes no sense. Like, and that's what hospitals do, is they set you or anchor you at a very, very high number, then give you a big discount off that very high number. But it is still a wacky, number that makes no sense in any other place in the world other than healthcare. I'll give you a quick example of this transparency, since you're kind of focusing on that, which I think is a great thing to focus on. I unfortunately went to the ER last year, ended up being a nothing burger. But I went in and I was put an IV, and I got an IV with a saline solution. Saline solution is basically just salt water. I was on saline solution for 12 hours. I used about 1,000 milliliters, which is about a bottle of water that big. And I got charged $5,000 for it. I could go on Amazon, and I actually did. And I got it for $8. So that's what the hospital tried to charge me, $5,000 for an $8 bottle of water. Then they thought I was having a stroke. I was having a migraine. So they told me, oh, it's not a stroke, so we're going to let you go. Like, great. Next thing I know is a physical therapist and occupational therapist come in, and they say, oh, I've got to provide you these services just to make sure that you can go home, and not hurt yourself. And I'm like, you just told me I didn't have a stroke. Like, I've got a migraine. Like, it's not that big of a deal. Oh, we just got to do it. No big deal. Just let us do it. Put on these socks. So I put on the socks. Brush your teeth. I brush my teeth. Walk 20 steps. I walked 20 steps. I was like, okay, you're good. See ya. The entire time they weren't even looking at me. They were talking to my wife. Funny enough, and so I get the bill. I got charged 8 15-minute visits for them being there for 10 minutes, watching me brush my teeth and put on socks. Each one of those visits was $250. So I got charged, no, excuse me, $400. So each time, so I got charged $3,200 for a 10-minute visit by a physical therapist and an occupational therapist. And if I didn't know better, right, the health insurance plan, if I was on health insurance, would have just paid it. Maybe they're like, we don't know. They said they were there. I don't know. With CrowdHealth, what we did is we got that bill. We can walk through that bill, and we can say, oh, tell me about your physical therapist, your occupational therapist. Oh yeah, they were there for 10 minutes. They're like, wait a second, they charged you 8 times, right? And so we knew that was bogus. It was a fraudulent claim. Tell me about this saline solution. Yeah, I was on it for 12 hours, and it was a little drip. And I was like, okay, let's do the math. It was about 1,000 milliliters, and they're charging you $5,000 for that. Well, what we do is we go through that. We walk through it with you. We make sure there's no errors. By the way, 80% of medical bills have errors in them. And so we can get rid of all of those. And then we can go and say, negotiate on your behalf and say, how dare you try to charge, our member $5,000 for an $8 bottle of water. We can do those things. And so we can significantly reduce your cost because we know what those are supposed to cost. You probably don't. You might, Tom, because you're a doc, but like most 99.9% of the population has no idea what these things are supposed to cost. We do. We can walk through it. We negotiate it. We can get it down. And that's another thing where we're getting 60-70% discounts versus what they're billed, which is about a 50% discount from what health plans pay. And so we're able to get much, much better pricing because we're walking through this, because we're negotiating, because we have an actual incentive to see these bills decline. So that's the kind of the value of having somebody on your team as an ally, as opposed to somebody who's your enemy, trying to negotiate these things. So there's a lot there that's just so screwed up and so much waste that we can rip out of the system by, just giving you some tools to allow you to do that.
Yeah, and I think that's an important public service announcement for everybody listening, no matter what their situation is currently, is that you should never pay that first bill.
Never pay the first bill.
Ever pay that first bill. Because another thing that happens is that many of these insurance companies, because they have different contracts with individual hospitals, oftentimes the coding sequence that the hospitals have to submit to the insurance companies is different. And they will not tell the hospital which coding sequence they have to submit. So oftentimes the first one that comes in, that's why the hospitals have to have an army of billers, because they will get so many rejections back from the insurance company. And they're like, okay, well, that's denied. I got to try this other code. And then we'll see it and send it. And then it's like, it's insanity, right? But that's how the system works. So when that code comes back denied, it's not necessarily that it isn't covered. It's that the wrong number went from the hospital to the insurer, but then you get the bill. Right.
Mm-hmm.
So, whether first thing is do not pay the bill and then find an advocate. Right. And if you can't be your own advocate, you need to find somebody who's educated and can do that for you, which is one of the best things, right, about CommunityCare and CrowdHealth, is that you have a dedicated personal health advocate who walks that walk and holds your hand through that process. And it's not on you. I mean, I cannot imagine anything more stressful when you're having a significant health event and going through this period of uncertainty, and you lose work, and then you get this bill that, as you alluded to, 80% of the time is wrong, right, and inaccurate, and we feel like we have to pay that, right? So that's something that needs to change, and that's one of the great things about your company and CommunityCare going forward, is that we have a built-in solution for that, which we're really excited. The one other thing I wanted to mention too that I think is really important, when you were talking about 15 hours lost, right? Essentially 2 days of work from a physician standpoint in productivity. We cannot ignore the relationship of the administrative burden to physician burnout and patient frustration, and the role that that plays in driving people out of the practice of medicine. It is debilitating to have to fight that fight every day of the week, to advocate for things that are necessary, communicating with people who are not evaluating the patient, not seeing what you're seeing, may not even be a specialist in the field that you're requesting a diagnostic study or a referral to. It's the practice of medicine without evaluating the patient by somebody who's probably not even a physician in the same specialty of what you're submitting
Mm-hmm.
for, right? We have to make these changes for everybody, right? It's just as important for our economic survival as patients and as Americans as it is for the survival of physicians and other healthcare practitioners, because they're just as frustrated and upset as the patients are.
Yeah, but just one thing on that. One of the things I hated when I was fighting my bill with my insurance plan was that I had to call into a call center, and I had to go to 14 different, if you're calling for this, press one. If you're calling this, and then I get connected finally, and I'm talking to somebody in a foreign country, and they don't know, what I'm talking about, and they have to punt me to somebody else because it's the wrong service, and that's the wrong number. Then I got to call back. I got to do it again. I hated that. I think it's awful customer service. And one of the things that we do is every CrossFitter will have a care advocate internally. So you're going to talk to the same person 90% of the time. If you have a complex thing going on, that care advocate is going to bring some other people into the equation to help you. But we have a care advocate who's on your side as your ally, walking you through a complex situation, right? And that's just so important, because oftentimes healthcare is complex. Working through the system is very, very difficult. Fighting with a hospital is not something I want to do. It's like the last thing on my list that I want to do. But so we have a care advocate. We have a coding specialist who worked at the University of Virginia Medical Center, one of the leading medical centers in the country, who did this on the health plan side, who looked through all these bills, who knows this stuff backward and forward. We also have a team of attorneys who will negotiate this bill on your behalf. And so, my point here is that we don't want you to be alone in a very complex situation. We've got a group of people who will be your team, who will be on your side, who are your allies to help you in fighting for you, as opposed to fighting against you in this system. So, I think so many people are kind of like bewildered by the healthcare system because it's so complex. We try to simplify it. Right. And everything that we do, simplicity actually is a core value of ours. And so we're trying to make this as easy as possible on our members to navigate this complex system. And I think that's just really, really important. I've got somebody I can text, I can call whenever I need to, that is there for me. And it's the same person every time. They get to know you, they get to know your family, they get to know your health condition. And it's just a much, much better experience than calling into a call center in India or somewhere that has no personal relationship with me, whatsoever.
Yeah, maybe you can talk a little bit about that, Andy, and just what the experience is like if you have a health event and how you interact with the app and kind of what that looks like, just to give kind of a sense to people of what this looks like when something happens.
Yeah, sure. So let's just take, worst case scenario, you go to the ER. You go to the ER, and what you do is you say, hey, I'm a cash pay patient. And there are federal laws that basically say that they have to treat you the exact same way as they treat somebody with insurance. And I've talked to a lot of ER docs. I don't know about you, Tom, but like every ER doc I've talked to, they're like, I don't know what the insurance status is of this person. I just take care of them. I just take care of them to make sure that they're okay.
We're actually not even allowed to be involved in that, right?
Right.
So have registration staff that come in and do that so that we aren't even in the loop on that. So it literally means absolutely nothing to us, which
it means nothing. Yeah, it means nothing. And for people on this call who don't join, CommunityCare, one of the tips I would give you is they give you this bunch of paper to fill out, when you're sitting there. Imagine you're in the ER, you already have a big condition, and they want you to, sign a bunch of stuff. One of those is called a financial disclosure form. And basically what that form is going to say, I'm responsible for all the charges, regardless of what they charge me. And so what I do, and I tell our CrowdHealth members to do, and what we tell CommunityCare members to do, is strike through that line and say, I will pay reasonable charges. And that then gives you the negotiating leverage later. Or if it's on a tablet, what I do is on the signature line, I'll say, won't sign. And 99 times out of 100, they're like, don't even pay attention. They're like, okay, great. So that's just one little tip for people who go into the doctor's office or even the dentist. Like, look at that information so that gives you some coverage, some protection.
Yeah.
So you're in the ER.
That tip can save you tens of thousands of dollars.
Tens of thousands of dollars.
That's
worth your hour
in this visit. Remember that one.
Yeah, that's worth your hour of listening to me and Tom gab. So, you're in the ER, you tell them you're cash pay. They will not bill you in the ER. So if they try to, say no, send me the bills. So if you're a CommunityCare member, you'll get all the bills in the mail. You go to the app and you just take a picture of the bill and submit it. And then what we do on the back end is we take all those bills, we reach out to the hospital on your behalf, and we say, hey, we're negotiating on behalf of Jen. And so we have attorneys who do that for you. We'll negotiate that bill down to a reasonable rate because we know what the reasonable rate is. We have all that data on the back end. And then we'll reach back out to Jen and say, Jen, I'm picking on you. We're reaching back out to Jen and say, hey, we took your $50,000 bill and we negotiated it down to 15. Are you okay with us now going out to the community and funding this? If Jen says yes, then we'll take that $15,000 and we'll ask, 100 people for what is my $150 if I'm doing this math right. And so we go out to 100 people. We say, hey, Jen, or somebody XYZ person, and you're in Ohio, right, Jen? Yes, we have a member in Ohio who went to the ER. The bill is $15,000. She was there for a migraine, whatever it is. And, are you willing to help Jen? And you can say yes or no. But if you say yes, then money will be transferred from your account to Jen's account. And after we get through all the people to get your $15,000, now Jen has the $15,000 in her account. So then she can go and pay the hospital directly. And so that's how that would work. That's worst case scenario. But all we're asking you to do is one, just upload all those bills. We'll do all the rest on the back end. We might have a couple conversations with you around like, hey, tell me about this, this, and this. Did this actually happen? But then you have $15,000 in your bank account at the end of the day that you can then go and pay the hospital directly. So that's how that would work. And like I said, we've done this
when
20,000 times.
When I have a rash in my groin, does it go out to the community with my face and say, Tom has a chronic?
Say Dr. McCoy has a rash in a very odd area. No, we don't put names on there. We just put locations for privacy reasons.
Okay, got it. Okay.
There are some questions that I want to get to, but I just want to,
Sure.
I want to reiterate, I think the importance, because I've had the opportunity to speak to a lot of people over the last few weeks that come with questions that kind of will go in and around what do I say when I go in for care? Am I cash pay? Am I that? And there's a practical answer, which I think you did a really fantastic job of explaining, but I think emotionally and psychologically, there's a connotation that comes around with being uninsured. And for what it's worth, it's either something that's come down from the social implications of the hierarchy that makes it equitable to status or something. But like, I think drawing on, again, this point of autonomy and a community-driven initiative that helps you feel powerful in the fact that you're advocating for the type of care that you want, because we shouldn't be in a position where we're denied care. And unfortunately, that happens way too many times where we feel powerless and out of control. And so there's a really exciting sense of self, I think, that comes with understanding how to leverage the tools to take back control of these things. So if both of you just want to quickly comment on maybe that more like emotional and philosophical kind of approach to this, and then I do have a couple questions before we wrap up.
Yeah, I'll start. I think that, the system as it is structured has done a very good job at, to a large extent, gaslighting us into believing that we are paying for healthcare. And this is not what's happening. And, one of the things that I think is very important for everybody to do is to take the time to become educated about where the money is flowing, who it's going to, and what's happening to the patients and the consumers who are supposed to be benefiting from these premiums, right, that they're paying. But the system as it is structured is completely misaligned with creating and sustaining health, right? As we've outlined, it benefits and generates more income as prices go up, and prices only go up when we get more sick, we have more procedures, we need more hospitalizations, we have more inpatient bedtime, or we need more medications, right? And this is diametrically opposed to at least what I know to be the CrossFit community, who takes a very active role, right, in the creation and the maintenance of health within ourselves and within the small communities that we're a part of. And what CommunityCare allows us to do is to function within a system where the incentives are aligned, where the creation and the maintenance of health allows us to keep more money in our pockets, but also when we do utilize the system, right, it's in an appropriate and a structured way so that we're actually paying and advancing the mission of health, not the creation of disease. And I think not just because it's financially beneficial, which it is, but ethically, all of us need to take the time to understand kind of the forces at play and what feels right to us. If we were going to build a system today, what would we want it to look like? Would we want to encourage and pay for the creation of disease and for dollars to flow to people who aren't contributing to improved outcomes? Or we want the opposite? And so, that's one of the reasons why, I'm so passionate about this, and think that it really is, the future of paying for healthcare expenses. Because not only does it decrease cost, but it gives us all back a sense of, control, one, autonomy, but also self and personal responsibility, for our health. And I think that's something that CrossFitters take very seriously.
Yeah, I think that paying in cash and saying that you're paying in cash to me is incredibly empowering. It's just like I'm not a part of the system, and if people look at you funny, like screw them. Like I'm not a part of your system. You're the one getting screwed, not me. This guy on Twitter had a funny story where he was like, he was in line. There's a woman behind her, and he's like, "Hey, I'm paying for XYZ," and the lady at the front desk was like, "Great, you get a 40% discount by paying in cash." So he paid. The lady in back of him in line goes up and says, "Oh, I'm paying with health insurance," and the person at the front desk says, "Oh, I'm sorry, that health insurance doesn't pay for that." And he just kind of laughed. He's kind of like, like you guys are a part of this stupid system and I'm paying in cash and getting 40% discounts. Like you're the ones that are the goofballs, not me. So I think it's empowering. And I will tell you, when you tell the doctor that you're cash pay, like there's a grin that happens. And I wish we had more time because I've got great stories around that. But like doctors love the fact that you're paying them in cash and you're reestablishing the doctor-patient relationship. They don't have to deal with health insurance. Because anything big that you and the doctor want to do, it has to be pre-authorized, which means the doctor has to do a bunch of work. They have to get approval. They have to do all these, administrative things. Whereas you pay cash, it's you guys make the decision. The other thing, part of this is there's no networks. So you can go to whoever you want. So you're not going to go to be able to go. You don't have to go to somebody who's like, oh, are you in network? Are you out of network? It's like, the world is your network now. And so that's empowering too. I can go to whoever I want. And we love people go into integrative doctors and holistic doctors and chiropractors and all these types of things. Is you're not limited anymore by who your health insurance plan think you should and should not go to. So, it is, I understand the sentiment of being a little bit embarrassed. I will also tell you that I talked to a orthopedic surgeon late last week, and I asked him about this. He's like, you know what? When people say they pay in cash to me, I think those are the people who are loaded. Like these are like, screw this system. I'm out of it. I don't want to have to deal with health insurance. Like I'm just going to pay for it myself. So I think there's just as many doctors that probably go the other way. That's like, this person's a real deal. They're paying for the healthcare themselves. They're taking personal responsibility for it.
And the crazy thing is that you're saving money by doing that.
Yeah. You're saving a ton of money by doing it.
You have a ton of extra resources that, the tens of thousands of dollars that you're paying in premiums every year that you never utilize. And then if you do try to utilize it, have to pay a huge deductible and then fight to get what you deserve and have been paying into the whole time. It just never happens, right? All that money stays in your pocket, which you can devote to other very fruitful endeavors, much more so than premiums and deductibles you're never going to see back again.
All right, you two. Will there be a role for health savings accounts?
Go ahead.
I think with this new administration, I think there will be. Yeah, man, I think there will be. I think from what I understand, and we've got some people actually on our board who are talking about this, that they're trying to bifurcate these high deductible health plans from HSA so that anybody can have an HSA. And so while, initially there's no place for HSAs in terms of like putting more money into HSAs, you can still use your HSA for any medical expenses that you want. So that we don't keep you from having to you can use HSAs for any medical expense. We don't care if you do that. But I do think if I were a betting man that before, the next, midterm election, we will probably have the ability to add to HSAs as a part of our program. That would be my guess.
Yeah, and I think, with reading the tea leaves as they're laid out, I would only expect kind of the reach and the ability to flex HSAs to grow
To grow.
months and years. And I do think it's important to highlight that, you can utilize an HSA to pay your medical expenses. And so when you have a significant event, right, through CommunityCare, the community covers that, but you are paying the first $500 of that, right? So if I go in
the big ones.
a major surgery, right? So I have to, you know, have a acute appendectomy or whatever it is, a huge ortho procedure. You pay the first $500 and then the community pays the rest, but you can have that $500 in an HSA, right? So what I tell folks is
Absolutely.
just say it, and just keep that tucked aside. So instead of having to pay a $10,000 or $20,000 deductible, you have $500 and you know you're never going to pay more than $200 a month, and you just keep that $500 tucked away. Like, you are covered for anything that comes your way, which is hugely different. When you look at the numbers of people where if they have a major health event, most of them will have to shell out, you know, I was just reading an article the other day, it's about $14,000, right? Was the average cost of an individual if they had a major health event, if they would have to pay into their deductible and cover the extra costs. The vast majority of individuals would not be able to come up with that money. They would have to either
Yeah.
go onto a payment plan, right, which you would have to try and negotiate with the hospital on your own, which gets tricky. You would have to use your credit card, which has, you know, a horrendous interest rate and is going to end up costing you a crap load of money, or you have to borrow money from friends, right? That was the vast majority of individuals. Not many folks have an extra $15,000 or $20,000 set aside just for a major health event. And now you can be completely covered just by having 500 in an HSA. Like, that is a game changer, right? And this is the reason why major health events and medical debt is the biggest driver of bankruptcy, right? In the United States, 330,000 of the 500,000 or so that occur are driven and initiated by medical debt. And we can take that off the table for our community, right? Which is hugely important.
And 200,000 of that 333 actually have health insurance, right? So this is like, you have health insurance,
right,
and you still go bankrupt due to a medical event. Like, that's how crazy our health insurance is.
Unbelievable.
All right, we got another good question. How does it work for people with regular prescriptions?
Yeah, most of the time with regular prescriptions, they're incredibly inexpensive. Most of these are generics. You know, I think she'd be okay with me saying this. My sister is a part of CrowdHealth. She's got a couple, you know, that she has to take every month. And she was really worried about it. She's like, okay, you know, like CrowdHealth won't pay for these, you know, regular recurring prescriptions, but they were like $20 a month. I mean, they were next to nothing. And so one of the things that we do really, really well is find you prescriptions that are significantly less expensive. We had a woman with non-Hodgkin's lymphoma, and the med was $40,000 a month. And we were able to negotiate that directly with the drug manufacturer, down to $2,500 a month. And that was a part of her health event because she had non-Hodgkin's lymphoma. So the way that this works is if you have a health event, which includes doctor's visits, hospital visits, infusion therapy, medications, everything, that's all one health event. All we're asking you to do is pay the first $500 of that health event, and then we'll submit the rest to the community for funding. So that one is going to be, you know, $1 million bill when it's all kind of said and done. You pay 500, the community helps you out with the rest. So that includes the prescriptions. If you have a regular prescription for, you know, high blood pressure, or God forbid, we're taking statins, but that's a whole other story. Statins or whatever. Like these are
You said the S word. You better be careful, man.
I know. I was like, geez, I can't believe I was saying
it.
If you're on statins, let's talk. So anyway, like, those are all very, very inexpensive that we can find for you for more than likely $10, $15 a month per med. So those are not the ones you typically will worry about. And if you are worried about them, if you'd let us know what those are, we can actually go back and look at our database and say, okay, that's how much it's going to be in your area. So you don't have to worry about them. But I've not seen, maybe I've seen one person who had a really weird one that was not a generic, that was probably more expensive than they were willing to kind of pocket. But if you got any of those, please just let us know, and we're happy to take a look and see what those meds are. But they're not going to be that much, more than likely.
Yeah, I mean,
but the prescriptions with the health event, I just want to make sure people understand. If you have a big health event and you need prescriptions as a part of that health event, those prescriptions are included in that health event. So again, you only have to pay the first 500 before we'll send the rest to the community to help out with.
That's a really important point. And I would just add to that, you know, the vast majority of my patients still have some form of traditional health insurance that I see in my private practice. And I cannot think of the last time that it was less expensive for them to use their insurance for any medications they were getting, as opposed to
yes.
or another one of the discount cards. So
Exactly.
even another public service announcement, download GoodRx or one of the prescription apps and look at the cost difference at your local pharmacies for the same medications that you would have to be paying whatever your copay is through your insurance to get that prescription versus you using GoodRx. You will be very, very surprised.
And not every pharmacy charges you the same cost for the same prescription. So
Exactly.
it
very
kind of
different.
comes back to a little bit of due diligence on making sure that there's just a support system that helps you understand the most effective way to choose your care, right? And how you want to get what you want to get.
And this,
And we will help you with that. We will
Yeah.
help you with it.
That's the thing about this is that you could say all of this like, oh yeah, but you know, where do I have the time to do that? I don't have time to look. This is the beauty of this setup, and it's why it's so important that it's one of your core values is simplicity. The fact that you help people with that and you have a care advocate and you're helping them do that legwork and that research to find those more appropriately priced, high quality options. Like that's the game changer, right? So it's not on the individual completely, right? We're there to do that with them, which I think is a huge value add.
Yeah.
Okay, so very good. A positive comment from someone that was on had said that it feels like this at worst as much more cost-effective safety net health insurance. At best, this changes the trajectory of health for our country. And so I think that sliding scale will keep pushing towards, if we look at the CrossFit continuum, right, and we're always trying to go towards the right for improving our trajectory in general on our health. I think understanding that we're somewhere in the path of the trajectory that keeps pushing us on the side for continued improvement as we understand how, as a community and as the community grows, right, we will continue to do a better job of supporting each other as we unpack a health conscious step forward, right, and stepping outside of what we title this webinar is the disease economy, which whether that be financially or burdensome from any number of diseases or a sick care system. I hope we all leave with a hopeful outlook that there's a solution and an opportunity to go from the status quo of dysfunction or functionality that's not aligned to a more opportunistic future.
And I think
Amen.
that's an important way to outline it in that this takes, you know, financial catastrophe from a medical event off the table, right? And that should be there for all of us. And the fact that we have this kind of safety net coverage now that is appropriate and is going to be there for us and isn't going to cost us $20,000 when we have an event because we have an outrageous deductible, but something that's completely manageable by the vast majority of us and we can plan for and budget for easily month to month. Like that should be accessible to everyone in our community, and now it is. In addition to that, right, it incentivizes health, right? And we finally get to leverage our health and well-being to access resources and preventative care and do things in a way that's going to save us money and keep us healthier. And we didn't talk a lot about this, right? But as a member of CrowdHealth and CommunityCare, right, you get access to urgent care, telehealth medicine, you get access to talk therapy, mental health support from a telehealth standpoint, and that's included, right, in your membership. And these are things like if anybody has tried to access and get coverage for mental health care, I've had patients that have had to do this through insurance companies. It is not an easy thing to do, right? And so by just being a member of the community, the fact that you have that and that is a priority, right, for you as a company, I think it says a lot, right, about kind of where your values are and your mission to provide people the services and the resources that they really need, right, which is a big deal.
Real quick, one of the questions that is usually asked, I'm not sure, is what about the big one? You know, what about the really, really big ones? And I tell people like we actually do better with the big ones because we are able to negotiate these bills down. We had a guy who was in Montana doing what we all, you know, dream about doing. I know, Tom, you love fishing. He was fishing in a stream in Montana, and he was in bear country, wolf country, and so he had a 44 in his holster. And as he caught a fish, he leaned down. The 44 fell out of his holster, hit the hammer, gun went off, went into his calf, out the back of his calf, into his thigh, out the top of his thigh, into his chest, out the back. So One
Wow.
bullet, 6 holes. He looked down and he said he had, green stuff coming out of his chest and thought that he was dead. So we had a helicopter come in, landing in the middle of a stream somewhere to get him to the nearest hospital. He was in a coma for multiple days. He then went into sepsis for 2 or 3 weeks. And this is a $1 million plus bill. We're negotiating those bills down. It looks like it's going to be closer to a couple 100,000. And that's something the community can take care of pretty easily. We've had 24, maybe even 36 now cancer cases. We've had major motorcycle accidents. We've had heart procedures, brain procedures, pretty much everything you can think of. The community has been able to take care of for these people, and at a much, much lower cost. I talked to that guy a couple weeks ago, and he's like, "Man, this has been so easy with CrowdHealth. Like, I thought this was going to be." And as I told him, was like, because a gun went off. He's like, "I'm not sure you guys are going to actually help me with this." And when I told him, I was like, "Man, we're there for you." You could hear his wife in the background. It actually makes me emotional, like crying. She's like, "What? They're actually going to help us?" And when he woke up from his coma, all the people in his family were gathered around him because they thought he was going to die. And the first thing that comes out of his mouth is, "Oh, by the way, we're pregnant." His wife was like 10 weeks pregnant.
God, you're kidding me.
It was such like an emotional kind of moment, right? And so like the fact that we can help these people, and the cool thing is I know my money is going directly to Michael to help him with his gunshot wound. It's not going to United Healthcare. It's not going to Cigna or Aetna to buy a CEO a yacht. It's going directly to Tom or directly to Jen. And I know exactly where my money is going. So I know we're 2 minutes over, just real quick. We have a bunch of situations where, we have a miscarriage. And so we send that out to a bunch of people. And a lot of the women will come back and be like, "I know what this family is going through. I know the pain of this. I know what, the trauma that they're going through as a result of this. Instead of the $100 that you want from me, can I give them $200?" Like, and you would never have that with United Healthcare. You would never call United Healthcare and be like, "Can I give you more this month?" Like, it just doesn't happen. And that's why I think that CrossFit and what we're doing with CommunityCare is such a perfect merger, because you all care about each other. I know you do because I've seen it. You tell lots of stories where you gather together and help one of your CrossFitters through something hard. This is an ability for you all to do that with other people's healthcare expenses. When somebody has a baby or accidentally shoots themselves or tears an ACL or whatever, you're helping them directly as opposed to paying money to this big multinational corporation. And I think that's the beauty of this that differentiates this from anything else that you will see out there. So, if you're listening to this, I'd love for y'all to join CommunityCare, because we need people to, help fund each other. And I think it's a really cool opportunity to do that as a CrossFit community.
Well, on that note, I want to say thank you for joining us this evening. I have a ton of emails for folks that want this recording sent out, so I will make sure it gets on our YouTube and sent out, and hopefully they can digest it all and follow up with more questions. In closing, if you do want more information, you can go to the CFMS website, so CrossFitMedicalSociety.com. The folks at CommunityCare have amazing experts that know this inside and out and can walk you through any theoretical potential what might happen situation, conversation, question that you have. Because as Tom said earlier, like, we're empowering you to try to be as educated as possible about a decision that's going to make the best sense for you. And so you are the driver in that seat, always. And so we will wrap it up. Sound good?
Thank y'all.
Thanks, friends. All right.